A very good afternoon, and thank you INSAP for inviting JAG to provide a gender perspective into the 12th Malaysia Plan. The Joint Action Group for Gender Equality is a coalition of 14 women's rights organizations in Peninsular Malaysia, Sabah and Sarawak. And since 1985, we've been advocating for gender equality and social justice in Malaysia. I will first give an overview before I go into the direct recommendations that we have. Malaysia stands at a critical crossroads. The COVID-19 pandemic has amplified existing gender inequalities and threatens to erode the progress we have made towards eliminating gender-based violence and discrimination. However, the pandemic and MCO has also shed light on how we may not only recover, but through swift and bold action, come out of this crisis more equal and economically stronger. The organizations comprising JAG and other NGOs have observed firsthand how the pandemic has eroded gender equality in key areas. And some of the key areas are in gender-based violence response, women's employment, and women's healthcare. We also observed that the stimulus measures implemented after the start of the pandemic really fell short of embracing a gender lens and reaching the women most in need. However, we did a complete assessment of the extent of the gendered impacts of the pandemic and the design of necessary policies to offset these negative impacts are really compromised by severe gaps in sex disaggregated data. Thus, we hope that the 12th Malaysia Plan would focus on the systemic and standardized collection of sex disaggregated data for all sectors, with the particular focus on data related to gender-based violence. The 12th Malaysia Plan must be grounded in the need to invest in all women, especially in their education, health, social status, and job opportunities, with an emphasis of gender equality and women's empowerment. The plan should highlight progress, challenges, and implementation gaps towards women's empowerment, but also provide a roadmap to strategies to effectively implement international commitments on gender equality. So we really need a roadmap and not just a recommendation from the government or how it should be placed. The 12th Malaysia 5-year plan, 2021 to 25, must improve accessibility and leave no OKU behind. Malaysia has a disability prevalence of 11.1% among adults. And among children between 2 to 17, the disability prevalence is 4.7%. And women who are the primary caregivers of persons with disabilities, whatever affects persons with disabilities has an enormous impact on women in Malaysia as carers. So at the same time, women and girls with disabilities are our hidden sisters. They are overlooked and unable to access the built environment, ICT, education, and training opportunities and services. Say in just over another decade, say by 2032, 20% of our population is expected to be age 60 and above. Aging is closely associated with further increases in disability prevalence. For example, aging-related vision loss is rapidly becoming a major healthcare problem. And with a population that is aging at a pace that is unprecedented in history, the 12th Year Malaysia Plan must urgently accelerate accessibility initiatives to transition to an aging society. Accessibility must be based on universal design and increases in safety and ease of use for everyone. Malaysia has embarked on strategic rollouts for digitalization and connectivity initiatives, but we are technologically 2 generations behind regarding information, communication, technology, ICT, access for women and girls and men and boys with disability. Print disabled Malaysians face a famine of accessible information and reading materials. So Malaysia must urgently address this. Be prepared for the rising number of persons who would benefit from accessible websites and accessible reading materials. So that was basically an overview, and I just have 5 concrete recommendations. So the first recommendation is improving gender-based violence response. Especially after the pandemic, we've realized that our response is far than is what was expected. We really need to set up a shared 30 million ringgit interagency fund to train first response to gender-based violence. We should earmark 50 million ringgit to expand the availability and accessibility of crisis shelters for gender-based violence survivors. We need to allocate 5 million to operate and improve 24/7 telephone crisis service in Malaysia. Make available a separate annual fund of 20 million to combat gender-based violence as part of a disaster management response so that we can have critical services and that can remain available when they are needed most. Our second recommendation is closing the gaps in women's employment. I believe Tan Sri Raman Raviratnam just mentioned about shared prosperity, equal opportunity, and should be for all races, for all ethnic groups. And that it would include, I would like to stress, for all genders, and that would include women. So in closing the gap in women's employment, the first thing that we have in mind is create more opportunities for women's participation and advancement in the labor force, including to achieve 59% of women's participation in the labor force by 2025. And how do we do that? Create a more conducive working environment by expanding flexi working hours. Create a database of daycare centers to allow for searching and comparison. Create an enabling environment for women in middle management to ascend to top management. Increase top management positions in the private sector to 30%. Hire women after career breaks. Increase financial incentives for SME employers as they require more support to change from the current system that we have a single peak trend to a double peak of women's labor force participation rate, and support women who want to return to the workforce by strengthening the career comeback program, which includes upskilling, reskilling, coaching, and mentoring, and adopting appropriate measures to improve women's ability to earn income beyond the traditional occupations that we are so used to. The second way to close the gap for women's employment is to have subsidized adult education and lifelong learning programs for women after their career breaks to close the gender gap. Increase the affordability and availability and accessibility of childcare by providing consumer subsidies. Eliminate discriminatory practices against women in employment and create an environment conducive to women. How do we do that? One critical step is to enact the proposed amendments that we have made to the Employment Act to make the workplace more family-friendly, including prohibiting discrimination against employees and job seekers on the basis of gender, race, religion, and disability status. and introducing a minimum of 7 days paternity leave in the private sector and increasing paid maternity leave to 98 days and protecting workers' rights to flexi working arrangements. The other need that we need to close the gap is to address the economic rights of foreign spouses, including prohibitions on work, which will help Malaysian families. See, every year, immigration issues an estimated of 150,000 visas annually to spouses of Malaysians. However, these individuals face significant barriers to employment, which harm and impact not just the foreign spouses, but also the Malaysian family. And many of these foreign spouses are professionals or skilled workers. By employing them, we would add to Malaysia's permanent workforce and contribute to the country's development and increase the taxes collected. So we recommend removing the prohibition from employment. The third area of recommendation is, of course, strengthening the primary healthcare response to gender-based violence. We need to prioritize building the capacity of primary healthcare to respond to gender-based violence. We need to ensure the full and continuous functioning of all our one-stop crisis centers in the major general hospitals across the country. And right now, only a very few of them are working. Designing a national strategy to reduce the maternal mortality rate as part of a long-term plan to improve sexual and reproductive health care for women and girls. Our fourth recommendation is enhancing women's political participation. We need to establish a mechanism for women's equal participation. There's a whole discussion on this. I won't go into it. I just give a one-liner to say that we need equitable representation at all levels of political process and public life in each community and society, enabling women to articulate our concerns and needs. The final recommendation is responding to gender disability intersectionalities, leaving no one behind. You know, we talk about disability inclusion, but disability inclusion needs really a cultural shift. And the recommendations that we have is allocate 20 million for digital accessibility of Malaysia. What we need to do is develop and implement a national strategy to achieve by 2025 Malaysia's accession to the Marrakesh Treaty to facilitate access, publish works for persons who are blind, visually impaired, or otherwise print disabled. And that would be the responsibility of the Ministry of Domestic Trade and Consumer Affairs and Ministry of Foreign Affairs. We need to issue national guidelines for compliance for all web developers and publishers, conduct nationwide ICT training and advocacy program to technically enable and encourage compliance with these national guidelines for digital accessibility. That would be the responsibility of the Ministry of Domestic Trade and Consumer Affairs, Ministry of Communication and Multimedia, and Ministry of Education. We need to set up an independent approval body for digital accessibility. We need this to check and evaluate prior to approval of digital accessibility provisions in all plans relating to social media and all other online platforms, as well as publishing. Support Malaysian schools, colleges, and universities in establishing an efficient and sustainable system for securing accessible reading materials available worldwide. The second allocation that we wish to have is allocate 20 million to strengthen physical accessibility, which is the responsibility of the Ministry of Housing, the local government, Ministry of Transport, and Education. We need to conduct a policy research study on the accessibility and usability by persons with disabilities of the infrastructure, facilities, and services. We need to gather this data regarding the extent of the compliance of UBBL 34A the Malaysian standards 1184/2014 and 1183. By doing this research, we can identify the compliance, the implementation, and enforcement issues and make policy recommendations. I mean, if you go to so many of these universities or colleges or public utilities, accessibility is a major issue, and we're still talking about it. Since even the time we had the Persons with Disability Act, which is really a toothless act, which has no redress mechanism. We need to develop a national accessibility strategy for implementing universal design principles and ensuring compliance with Malaysian legislation and standards on accessibility of the built environment. We need to set up an independent approval body for physical accessibility at the federal level with state branches to check, evaluate, prior to approval, access provisions in all plans related to the built environment and built transport. And also establish and implement a national program to fill knowledge and skills gaps for fast-forwarding Malaysia's progress on physical accessibility and related services. Example like large print signage, sign language, interpretation services at the information desk of major public buildings in preparation for our aging society. My last note on this is, I'm within time, wow. Update and strengthen the curriculum of the education and training of all building and infrastructure related professionals and construction personnel by including universal design and the technical requirements for accessibility as a compulsory subject. Thank you. That's Jack's input into the Malaysia Plan, draft Malaysia Plan.